Hi, I'm Emily Roger, host of the Boiling Point podcast. My co-host, Dave Vale, and I will bring you thoughtful discussions with leaders who are positively impacting our world. This is The Boiling Point, where leadership and inspiration meet.
Hello, Emily.
Hi, Dave. How are you today?
I'm good. Good. It feels like it's been a while.
I know. Even when it's been like a couple of weeks, it feels like it's been a long time when I go without chatting with you for, that period of time. Although I guess it's been like, I think 3 weeks, closer to 4 weeks this time.
We're in the, we shouldn't even talk about what month we're in. That's good, because we're not going to timestamp this, but it's one of those months in the year that feels very long to me, even though it's the shortest month of the year, so people can figure out what month it is. But it has been a while, and it seems like when we get back together and talk, I must ask, where have you been most recently? It's kind of like where's Emily in the world, or where was Emily in the world? I know you're back in New Brunswick, but where were you?
Yeah, my last trip, I just got back 2 days ago. I was in Argentina, spent close to a month down there, was visiting a couple of different fly fishing lodges down there, was hosting a group at one of the fly fishing lodges, and also meeting with some clients in Buenos Aires, and just spending a little bit of time based out of there. Had a few days kind of in between each lodges where I just hunker down and work from a hotel room, and had a phenomenal time. I love it. I love Argentina.
I've never been, but it sounds fabulous. And you know and actually we should point this out, is that while you're away, you still actually are coaching.
Yes.
Which is pretty cool profession to be in, when you can travel, but as long as you have your laptop, you're accessible. And I know you build coaching right into what your travel, so it's like you don't miss a beat.
Yeah, no, it's funny because I think that so many people who don't really know, from a business standpoint, what I do, they just think that I'm just traveling all the time and never working, when it's like, no, every single day I am still working. So whether it's before going out fishing, sometimes at noon, depending on time zones, in the evenings, still working, and then taking a couple of days in between each, whether it's a hosted group or just a fishing lodge that I'm working with, that I am spending a few days coaching clients still in between all of that. And, it's so fun of just being able to find ways of integrating personally, professionally, everything into it. And it's like, I actually can't even think of the last time that I took a trip where I was not working. However, I love my job so much, and I love what I do so much, that it doesn't feel like it's a job that I need a vacation from, which is why I'm okay always just integrating everything together.
It's truly a lifestyle business, and I know that in some circles that's not like the most positive thing, but I think it's a really positive thing, because whatever that life is, you can build it around coaching. And in fact, so next week we're taking off as a family to Mexico, and my wife was asking me, she was surprised to hear I'm bringing my laptop. I'm like, well, yeah, I got to get some stuff done while we're gone. I mean, I can't just sit out in the beach all the time. I actually like what I like. To your point, like, I totally enjoy what I do. So why don't we make sure I'm doing that as well? And in your travels, you meet a ton of cool people.
A ton of cool people, yes, including the person who we have on the podcast today, who is Dr. Dan Arguello. And I met him actually at a lodge in Bolivia. We were fly fishing for golden dorado, and I wanted to have him on the podcast because Dan he's a emergency medicine physician based out of Fort Collins, Colorado, also affiliated with many different hospitals in the area, But what really intrigued me about him is that he does a lot of work with the International Medical Relief Organization. And so him and I had quite lengthy conversations about the work that he does. And so I wanted to have him on the podcast to hear more about his work. So, Dr. Dan, welcome to the podcast.
Thank you for having me. It's always wonderful to see you.
What a treat. And you have the last name where only the vowels are pronounced.
That's right. Arguello, it just rolls off the tongue. Yes, I go by Dr. Dan every day at work because it's otherwise impossible.
Yeah. Yeah. So, Dan, where are you? Dave was asking me where I was just coming from. Where are you just coming from? Because you also were somewhere really fun.
Yeah, I was just fishing down in Cuba doing some humanitarian work where they kind of mix the fly fishing experience in with kind of studying the health of the marine national parks down there. So it's a wonderful time to meet people you wouldn't normally get a chance to interact with, and it's just lovely. So yes, I am I think 36 hours back and headed back to work tonight. So yes, that's why you can see I'm still wearing my sunglasses, which yeah, my family was like, you look awful, and I'm like, perfect time to do an interview with video.
You could have worn your shades, Dan.
It was close. It was close. Yeah. I was telling the producer earlier, like one day one of the other guys came back with a permit, but he was wearing a mustache. So all of us woke up the next morning and had these awful mustaches on. So I tried to clean it up a little bit, but yeah, sorry, it's still there. So yeah,
sharp, looks good.
All good. And so even when I met you in Bolivia at Samane Lodge, which was not a work trip for you, but it ended up being a work trip because I needed medical attention. And I was like, Dr. Dan?
Mm-hmm. Yeah, that is international medicine at its that is exactly it. It's yes, it's having accessibility to stuff you wouldn't normally have access to. And I mean, you saw this small, tiny little abilities that I was able to do down there make a big difference, right? And that's kind of what international medicine is. It's bringing something that seems very small and trivial to most people to people that don't have access to it regularly, and making a profound difference in people's lives because of it.
Yeah, well, you definitely saved me that week. That is for
That
sure.
was a rough week.
Everyone's going to be curious. What happened? Is this something you can share? Or?
Oh yeah, no, I was just having stomach issues, and it was like just not knowing, like, okay, how much of something I can take, because I was at the point where I'm like, just give me everything. Like, just like crush this up and like just inject this into me so I feel better.
It was crazy. It was just like a GI bug that kind of ran like fire through the group. There was one poor guy that I was like, dude, just take the medicine. Take the medicine. He's like, I don't really react well to medicine. He lost like 15 pounds in a week down there between like the dehydration, the humidity, like the volume loss. And then everybody that took the medicine within 24 hours felt great. But yeah, it was.
Do you know what's interesting with that? I remember, what do you take for altitude sickness or to fight it off, Dan?
Oh man, it's it's a steroid. You can use Decadron or dexamethasone.
Oh, yes, yeah, that's the one. So my family, kind of the last family trip, my parents went to Tibet, and they told my brother and I, who were both engaged at the time, guys, if you want, meet us in Shanghai, we'll handle the rest. So I was like, wow, that's cool. So we went to Tibet. Everyone took the drug except me, because I felt like I could just, mind over matter. Oh my God, I was sick. I was like, I mean, I bumped along in the back of the Land Cruiser they had, and everyone would get back and say, oh, what a great monastery. And I'd get out of the back and just like, why didn't I take that medicine? Like, it was just so stupid.
Yeah. And we're not talking about like huge medications, right? Like Decadron, right. I think the other one's probably acetazolamide but yeah, it's like better life through pharmacy sometimes, Not
100%.
always, but yeah.
I tried all the natural teas they had and stuff there.
Mhm.
Nothing worked.
Yeah.
It was like and eventually I got better, but it was like probably 5 days of just like headache, and it just felt horrible.
Yeah, I've never had altitude sickness, but I have no interest in it whatsoever.
No, I'd advise people to take whatever the drug is
But yeah,
before you get going, and
mm,
stay away from alcohol. And two things which I didn't do. So I didn't
right.
take drugs, and I drank beer as soon as I got to Lhasa. So there you go.
Yeah, that's a great way to give it to yourself. Yeah, Tibet's actually on my list. There's actually a lot of international medicine out in Tibet, oddly enough. But
Really.
yeah, yeah.
Hmm.
So it is on my list of stuff to do, definitely. Was it beautiful? Did you love it?
Oh my God. Yeah. It was, despite how I was feeling, I mean, stunning. And, we got, pictures of us as a family at base camp and stuff. And, you know, uh, with Everest behind us. And it was amazing. Yeah. It was a really cool kind of last family of four trip before the family expanded to,
Hmm.
you know, partner, wives in this our case, and then grandchildren. And so now it's like, I don't know, 15 or something like that. But it was kind of that last trip. It was, yeah, but beautiful place. Although I sense, and this is like 20 years ago, I mean, I think it's changed quite a bit, because you could see the development creeping up at that point. So I imagine it's a very different kind of looking place now.
Yeah, I remember I was enamored with Krakauer's books on climbing Everest, and I would be like sitting in my bed, nice warm cup of tea, just like all buried in the blankets, just thinking how awful it must be to be up on the mountain. I'm just like, ah, terrible, terrible.
So, speaking of 20 years ago, Dan, you
Mhm.
have been a physician for over 20 years. So, you must have graduated med school when you were 12, 13. Is
Ele-
that
ele- 11 and a half, actually.
11 and a half?
Yeah. So let's see. So I would have, yeah, I finished med school 20 years ago this year. Um, but what's even cooler about 20 years is uh, my very first ever medical mission was 21 years ago this year, my third year of med school. And I went to Trujillo, Peru. And this June, or I'm sorry, this July, I'm going back to Peru for the first time since then for my 10th medical mission with my youngest daughter, who's never gone on one
Wow.
of these trips with me before. So, yeah, I'm super geeked out about this year's trip. I'm pretty excited. I love Central America. That whole area just has a lot of appeal to me. Probably because I'm very tall there, which is not something I experienced anywhere else. I'm
I
just like, oh, hi, tiny people. How, oh, come, give me a hug. Oh, so, but yeah,
Like, are you the NBA player?
yeah, we've heard of you, El Gigante. I'm like, yeah, that's this guy right here, super tall. Yeah, it's like the first time in my life I had to like duck under like a shower head, and I was like, I'm never going home. These are my people. This is where I'm meant to be. So,
That's hilarious.
So funny. Well,
yeah.
you bring up a wonderful point that I want to actually talk to you about. And so you saying that your daughter is
Mhm,
accompanying you on these medical trips, and you and I have talked about me
mhm.
joining in on them, and clearly I am not a physician. And so yeah, like what are the ways that people who are not in the medical field or a physician, in what ways are they able to volunteer and help with these programs?
Oh my God, so important. Like, um, we talk about, like what can a person do who's non-medical? So my wife's gone to Haiti with me as non-medical as you can get. I mean, she knows a lot of medicine because she used to like quiz me during med school and residency, but like when she was a kid, they wouldn't let her, wash the dinner knives because if she cut her fingers, she'd pass out. So um, but there's so much opportunity for non-medical people to participate in. It's interesting because uh, you kind of get this perception that like, oh, it's a medical trip. What can I do? But every single person plays an unbelievably important role in getting a clinic to function efficiently and effectively. So when my wife went this last time, IMR, which is a group that I travel with, they do a really good job of making sure that every minute that a person is in that clinic, that they're getting something. And a lot of these people will, walk 1 or 2 days because they know that, medical people are coming into town. And what you don't want to do is have them, walk 2 days, come in, spend 5 to 10 minutes with me. And then that's the whole experience. It's like all this time that they can utilize. So, patients will show up and they'll get registered, which is kind of basically their basic name information, and then they'll go to a triage area. And the triage area is, kind of what's bugging you today, what can we help you with, vital signs, getting a list of their medications, height, weight, and that's stuff that we can teach anyone to do. Like my daughter, when she went, was doing vital signs and triage, and every person that goes on an IMR trip has an interpreter with them. So you don't have to feel like, oh, I don't speak Spanish, so I can't go to Peru. It's incredibly important that every piece of information we're trying to get to people gets there and gets there effectively. So after triage, they'll kind of go to it's like the waiting area before they see a medical provider. But while they're sitting there in a group, they do education on dental hygiene, hand washing. I mean, stuff that we all take really for granted. And like a lot of the times people will get their first toothbrush, like they've never seen a toothbrush before, and to us it's kind of like it's hard to even wrap your mind around that. And I remember my wife and my friend Betsy, who's our office manager, was on this last group in Honduras, and as part of the education, one of the things was saying, your teeth are permanent, you have to take care of them. Once you lose them, they're not coming back. And I remember my wife and Betsy were both like, I can't believe we're having to say this. And then a lady raised her hand and was like, well, what if we get vitamins from you guys? Won't they grow back? And like, there's this knowledge gap that we all really, really profoundly take for granted. And, and it's all the tiny things that take place there. And I don't know, like my daughter was, we have a kind of a limited amount of lab testing stuff we can do. So we can do pregnancies and urine dips, so we can check blood sugars for undiagnosed diabetes. And there was a woman there who had been basically urinating a lot, which, is a sign of a urinary tract infection. And when she had the urine sample done, she had what are called ketones in her urine. And that's a marker of being a diabetic. So, and my daughter, who is going to do business, nothing to do with medicine, like runs over. She's like, I know this means something. I know this is supposed to be important. And then we checked her blood sugar. It was 500, new onset diabetic. And because, again, IMR, who I travel with, they do just a really exceptional job of making sure that we establish partnerships in the countries that we travel to. That way, when we find something that, we're not going to be able to treat in a week, it's going to be a long-term illness, it's going to need attention, that they can find not only, the people in the area to have them follow up with, but oftentimes can help get the resources for those people to be able to pay for the follow-up. So, I did nothing for that lady. My kid noticing that she had ketones on a urine dip changed that lady's life forever. Like all the kind of really difficult things that a person has to go through with untreated diabetes. My daughter just being there and being in the moment and being conscious of what was happening, and those are the stories that I remember, like the little things. It's the tiny little things. And all you have to do is show up, be present, take a chance, and just have these beautiful, wonderful experiences.
Yeah. It's sorry, Dave, I feel like you were going to say something.
Yeah, no, go ahead.
Yeah, even around this thing, like you speaking about the like the dental hygiene. I don't even know if you know this about me, and probably many of the listeners don't, but I was a dental hygienist for 10 years and haven't practiced now for gosh, almost 10 years, kind of feels like a lifetime ago. But I still, when I travel to a lot of the destinations that I go to, I bring boxes of toothbrushes and we'll give like toothbrushing demonstrations and things like that to the children in the villages. And it is like I mean, now it doesn't surprise me as much, but at the beginning, like it always surprised me as to how yeah, like little education that some people do have, and that like the education and the healthcare is just so important. And this thing of that, we can maybe not be in the healthcare industry, but like you said, there's so many ways that we can still be helping out.
Yeah, we all have this like profound amount of knowledge just being born in, you know, really advanced countries. And I think we all just underestimate how much we have to offer other people.
Hmm.
And if you're just, I don't know, I don't know, like I don't think, and I've said this 1,000 times, there's nothing special about me. The only thing about me that I think is a gift is that I'm not afraid to fail and I'm not
Mm.
afraid to take a chance. And it's like, I found, I found this new group that I'm traveling with, like online, and a friend had traveled with them, and oddly enough they're based in Loveland, Colorado, which is like 10 minutes from my house.
Hmm.
And like I was like, okay, I'll take a chance, and I went to Honduras, and now I think I've traveled with them 6 times, and just my life is so much fuller and richer for having the chance to meet them. I mean, they're the ones that do all the work. It just, I don't know. And I know my wife was like, because she had gone to Haiti with me before and was like terrified of kind of what she was going to do. Is she just going to be in the way? And she worked so much harder than me. Like, the end of the day, just exhausted from like working the pharmacy or like helping move people throughout the clinic. And I'm, sitting by the pool having my little cocktail, like, oh, that was a wonderful day, no big deal. And she's like drenched in sweat, just exhausted. And it's like, yeah. So if you're wondering if you have something to contribute being non-medical, oh, we'll find something for you. We got you. We'll take real good care of you. So
That's so helpful to know, because I would have just made the assumption that you have to have medical training of some sort. So
mm-mm.
so how does it work? Like, is it they set up a clinic? When you talk about your first medical mission, like what's like logistically happening?
Mhm.
And I'm just curious, like, how does the word get out into whatever community you're in, that sort of thing. I'm just kind of just all these questions that's starting to come up in my brain, trying to imagine how this all plays out.
Oh, logistically, I wouldn't eat, man. If I had to do the logistics of actually making one of these things come to fruition, I'd be like, that's way too much work. Not for me. I'm out. But pardon me. So the very first mission I ever did, I went with a group of reconstructive surgeons to Trujillo, Peru, and we did, cleft lip, cleft palate. A lot of the stuff they do down there is a lot of the cooking they do is with kerosene, so there's a lot of fire and
Mm.
burn scarring, and a lot of these people will get like burned in over a joint line where they can't move their arm anymore because it's all contracted down,
Wow.
and they would just, logistically, the amount of stuff that went into that trip still just would be beyond me. But it's forward facing, tons and tons of advertising, because I think there's nothing more disappointing than if you travel to these countries with these expectations and these abilities, and then you get there and you're ineffective. So with the group I'm currently traveling with, International Medical Relief, they do a ton of advertising ahead of time. So people are kind of expecting the when, the where, what we'll be able to treat, whether or not we'll have a dentist, all these things. And then we bring everything with us. So most of the places, what we do is we just have a traveling clinic. So we load up with probably 20 bags of supplies every morning, get into a bus, drive anywhere from 30 minutes to 2 hours out into some remote village of some sort or some remote town, and we set up triage, and we have, equipment for vital signs and basic lab testing, and we bring all of our own medications in, and we're just like we're like a traveling circus just waiting to unfold. But um, again, the reason I'm so into the group that I'm traveling with right now is they allow me to feel, not only safe but effective when I get there. Because, if I showed up and no patient showed up, it's like, what am I doing here? Or if I showed up and there were a million patients and I didn't have any of the stuff to be able to take care of, the ear infection, if I didn't have the antibiotics, or I didn't have, the most basic stuff. Like, we don't travel with any controlled substances. We don't bring any opiates, any muscle relaxers. We bring antibiotics. We bring medicine for gastritis or reflux. We treat a lot of scabies or a lot of lice. I mean, really, really simple stuff that is just miserable for people to have to live with. And then kind of the next part of that, where it's like, can I be effective when I'm there? And then the next part is, well, what if I find something that I'm incapable of dealing with, in this one day or in this 1 week? So my first trip to Honduras, I met this little girl. I want to say she was probably 10 or 11. She was there with her grandma, and her grandma's like, well, she's got these kind of 2 bumps down in her groin. Most of the time that's like an abscess or an ingrown hair or something goofy like that. And what she ended up having were these 2 inguinal hernias that are super rare in girls, especially congenital. And basically what happens is your bowel is there's a little defect in kind of the muscle of your abdominal wall. And it allows, in the beginning, kind of a little piece of tissue, maybe a little bit of fat to poke through, and they can be a little uncomfortable, usually not life-threatening, but after a while, as that hole gets bigger, you can get pieces of bowel that poke through there, and if the bowel pokes through there, it can get twisted and ischemic, and then you get dead gut. And it's awful if it's untreated. And I'm not a surgeon. I don't have a hospital to work out of. I don't have an anesthesiologist, and I found it. And I went to Nellie, who, my God, I could tell you a million stories about Nellie. She's a saint in human form. But I told her about it. She's like, oh, we'll take care of it. And I was like, how are you going to take care of, inguinal hernias in Marcala, Honduras? And I got home, and within a week, I got these videos that were like her getting checked into a hospital, her getting prepped for surgery. They sent me video of the laparoscopic repair of this girl's hernias. And basically the minute that I gave her that information, she like tracked down a surgeon to volunteer his time in Marcala. She found a hospital that was willing to donate the resources and just took care of it. So it was like so eye-opening to me that, sometimes people go on these trips and like, dude, I didn't do anything. And it's like, sometimes all you really need to do is just identify something that, even if you can't treat it, to be able to have the resources around you of people to go find all that, and have it taken care of. And I mean, that girl's like that was a problem that was fixed within a week. And then I went back a year later, and I didn't know if I'd see her again. And her and her mom showed up to clinic, and they'd like baked all this bread for me, and we're just like, and it was 3 minutes of my time, and if you were to say, did I do anything? Not really. I mean, I was like, oh, look, you got a problem. And it's and again, Nellie, non-medical, she just started the clinic. You just find people with good intentions, and you can do amazing things. So yeah, I don't even know what the original question was there, but
you've explained it very well.
Sorry.
You explained it really well, like how to set up the clinic. But I think what I'm finding really fascinating as I'm listening to you is just how International Medical Relief as an organization is able to, and I'm assuming Nellie's part of that helped in this situation. Is that correct?
Kind of. She is actually, so Nellie, man, sorry, I keep going off on these stories. So
that's what this is for. This is perfect.
Yeah, we love stories.
This is all about stories.
So Nellie So Nellie is a woman that lives in Marcala, which is this very small town in Honduras where the main agriculture is coffee growing. Um, in Honduras, they have like a Children's Day where it's like its own little kind of national holiday where basically all the people get together and they celebrate children. So her kids had grown up and they had moved out, and she wanted to do something. So she threw this kind of little kind of block party at her house for her nephew. And it's a small town, and like kind of the center of the town is kind of like their whatever, like their central meeting place. It's, I don't know, kind of their governmental building or whatever you would call it. And she noticed that there were all these kids like sitting up kind of on the stairway up there, but they weren't coming down to the party. And Nellie was like, why aren't those kids coming down here? Like, do they know they're invited? And her nephew said something to the effect of, they can't walk down here. And it turns out they were kids that had some physical disabilities that kind of precluded them from being physically able to get there. So Nellie like jumps in. She's got this little like Toyota Tacoma, just little tiny Nellie. She's probably like 4 feet tall, barely see her over the steering wheel. Jumps in, drives up there, loads these kids in the back of a truck, drives them down, and she's telling the story. And she's like, and I did this like, I intended to do this wonderful, like joyous thing for my nephew. And she's like, and I just cried and cried and cried all night thinking about these kids. So the next year she throws a huge party and goes out of her way to make sure that every kid with any disability in the area knows that they're invited and make sure that they have transportation to get there. So then from this, she decides, why don't any of these kids have any therapy for their disabilities? Because there's no access to it. So she basically kind of goes around and does fundraising through the coffee cooperative down there called COMSA. And they basically over time build her a clinic. And it's the only clinic in Honduras that does physical therapy for kids with special needs and disabilities. Wow. So when we travel down there now, she has the clinic. She basically puts a week at a time aside and is like, this is your clinic for the week. You come and you take care of people. And like, she expects nothing in return. She has her tiny little warm home, and she has her wonderful life. And she does all of this stuff just because it's the right thing to do, Mm-hmm. And you meet people along the lines that do this kind of stuff, and you're just like, man, the world is so much bigger than what I see it as. And people around me are, you're just inundated with all the bad stuff in the world constantly, day in and day out and day in and day out. And then you find these people that are just like, just world changing earth movers that won't be stopped because they believe in what they're doing. And I am just lucky to have met her and to be a part of what she does. And yeah, that's Nellie.
I'm glad you told that story.
Yeah.
That gives someone hope, doesn't it?
It's just perspective too, right? Like when you open your eyes up to the things that you want to see, you'll find them, Yeah. Sorry, I'm totally geeking out thinking about her now. She's just,
no, it's so beautiful. And it is I like stories like this always move me. Listeners should not be surprised. But it's this thing too around like you talking about her seeing opportunity and acting on it. Mm-hmm. And then I heard you said something really powerful earlier, Dan, around that, like you have this gift of not being fearful of failure. Mm-hmm. And, I'm curious, like kind of two parts to this question. One, as to where that comes from for you. And then how, when we see problems that are just so seemingly large, mm-hmm. how do we not feel overwhelmed, but just go into that action mode?
Yeah. The first one's a long story. The second one, I always think I don't even remember, several years ago, my mom like gave me this like inspirational kind of poster picture thing. I think it said something. I think it was Mother Teresa. I know, quoting Mother Teresa first thing on a Monday morning. We're going deep, um, but it was something to the effect of, "If you can't feed all the starving children, feed one." You know, and I remember like staring at that and just being like, "That's really the key, right?" Like, I'm not I'm not fixing any international national problems, but I may be able to change somebody's life for a little bit of the better. And it doesn't take much. It doesn't take some special person. It just takes somebody willing to say that, when we talk about these trips, like for me, the core of international medicine is not, you know, we're not always treating something. I would say there's a large proportion of people that we see that are just worried well. And they'll bring your kid in and they'll be, oh my God, he's got this thing. And it's like, who knows what it is? Maybe it's like a little skin tag or something like that. But they'll be worried that it's cancer. And then you're like, it's 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 uh it's not a big deal, but it's like to give them that, to eliminate all that anxiety that they've been walking around with for God knows how long.
Mhm.
That's the gift. Or international medicine, again, I think at its like absolute core is a person showing up and just saying, how can I help? And I care enough about you as another member of the human race to come here and try, And it's like sometimes these like there was one lady who was like sitting down, and like I was sitting there with my interpreter, and she was just like almost not suspicious, but kind of like what's like kind of what's the deal here? And then my interpreter was just like, she just can't believe that you would come all the way from the United States to see her. And I was like, who wouldn't? Like, I've got the ability, um, like, just so many things worked out in my favor for me to be where I am today. That for me to think that I don't owe a little bit back to somebody, I think would be really, really just, well, I don't want to get on a soapbox with that one, but it's just saying that I'm a citizen of the world and I care enough about you to come here and try and make your life a little bit better. So, yeah.
Mm.
Yeah.
When part of what I'm enjoying about this, I mean, is about this story, about what you're sharing, or the many stories you're sharing, is to hear the amazing work that this organization does and you've been doing. But I think the other part for me is recognizing, is like actually anyone can do this, because, I wonder if sometimes people, I kind of have a theory that sometimes, even like I think in more, even in a local sense, sometimes people aren't contributing. They're not sure how to, or and so when there'd be like a kind of a small disaster or a flood or whatever, there's this outpouring because people feel like, oh, I found a path, I can do something, right? So sometimes it excuse me, might just be about not recognizing that you can do this. So glad you're sharing this not only stories, but and we got the URL up, but understanding what who IMR is and what they do and how it's really anyone can support it. That's pretty, I guess, for me, that I had no knowledge of that. So thank you for that.
Oh yeah. I mean, if it was just medical personnel who were involved, it wouldn't be able to do a fraction of what it does. And if it was all like, if it was all doctors, it would be the most boring trip on earth. So,
I don't know. I know some pretty fun doctors. So.
Yeah, I know one, maybe two. Just kidding. But yeah, and it's funny because even as a medical provider, it's hard to figure out like who's trustworthy, who's going to make sure that I'm safe.
Right.
I remember, so I was, when was the big earthquake in Haiti? I think that was like 2008. Sorry.
Sounds right.
But I remember they were showing like all of these devastating videos on like online and on the news, and I remember like I was like, oh man, I want to go. I want to go so bad. And I was talking to my dad, and the best part is like my dad, you know, he my dad, my grandpa, my great grandpa, they were all coal miners, you know. My dad was a coal miner until I was like in middle school. So they still just see me as like, you know, this kid from a small southern Colorado town. And he was like, and I was like, I want to go. And he's like, but what would you do? And he's like, they need like doctors for like trauma and stuff out there. I was like, that's what I do, Dad. Like that, this guy, like, um, and I must have spent 2 or 3 months trying to find a way to get out there, and never once found something that I felt comfortable doing.
Interesting.
Mm.
I mean, it's shocking because
Yeah.
I'm kind of starting an international program for the group of docs that I work with, our ER group. I think there's probably between docs, PAs, NPs. I think we're about a group of 100. And it's funny because I get back from these trips and I'm like, dude, go with me. And they're like, it seems overwhelming to do, right? So we've created this program now. I'm like, look, we created this web page that links with IMR. Go on here, click the buttons, upload the paperwork, and you're ready to go. It's like making it easy and accessible for people is probably the biggest challenge to getting people to go.
Yeah.
So,
Yeah.
like, I think I met Em, and I think I talked to you for about 15 minutes, and I was like, want to go to Peru? You know, like when Honduras. I mean, and it's like you just find people that like you get a sense that you know they would be fun to travel with. They have just a good heart, and you know they would not only would they do some really great stuff, they would probably have a really great time. Like
Mm.
I come back from these trips like more energized and full than anything else I do. Like a beach trip with my family is wonderful, but I come back and it's kind of like, you know, that was fun. Like we had a lot of fun. I come back from Honduras and I'm like exhausted and just, you know, falling asleep on the plane and everywhere else. And then like I'm just so full and ready to go. So yeah.
That's coming across big time.
Oh,
Yeah. No, like in terms of
feeling it.
making a contribution, feeling fulfilled. Like I was
Yeah.
almost thinking, and I know we got to wrap up here in a minute. Part of what's I'm coming away with is, and you haven't really said this, but you know, it's almost like you're getting so much more than you feel like you're giving is kind of what I'm taking from it, Dan.
Oh yeah.
Right. And it's the power of, you know, giving back is, you know, it's usually a tenfold payback, isn't it?
Yeah, and it's like, you know, so much of the world is like a zero-sum game, right? Like if I'm gonna go and do something and enjoy it, somebody else to give me something for me to enjoy it, right? Or like if I buy something, somebody's giving it. And with this kind of stuff, it's just like the neurochemistry of it all, right? Like I get this huge dopamine dump from doing this stuff. And it's like that doesn't cost them anything. It doesn't cost me anything, and we're both better for it.
Mhm.
And it's like there's so few opportunities where you know both parties come away feeling amazing. So yeah, I would say if you even have the slightest inkling or interest, like jump in, take a leap, take a trip. You can do a week trip. You can do a 2-day trip where you go like Sunday to Wednesday or Wednesday to Saturday. They do IMR does this great job of making it accessible and inviting and feel safe, but also being effective when you're there and making a difference. And people do it for different reasons. Sometimes people on these trips, they just want they want the social media picture. And you know what? Cool. Like whatever gets you to go and do it and try it, I'm for it. And if when you're there, you're not having a good time, I'm going to change that for you. I'm going to go out of my way to know that you are getting something out of it, because you're not going to come back if you don't. But if you if you take advantage of what you're able to get out of these trips, you're going to come back. You're going to bring your neighbor. You're going to bring your friend. You're going to bring your kid, and you're going to be so much happier and better for taking that chance, you know? So why not?
Well, if you listen to this after this discussion and you're good with it, Dan, I think you should share it with IMR and get them to share it, because you make a very compelling case. Like, you know what I mean? Like, I'm like, geez, we're going to Cancun, but I kind of rather go to somewhere like one of these medical missions. You know what I mean? Like, that's just what's going through my head right now. So you're like the perfect spokesperson for it.
Come with us. Come with us in July. We'll go to Peru together. 100%. That's an honest invitation.
Peru in July.
Yeah, and if that doesn't work, we can do Honduras. I think it's in October of this year.
Okay.
And awesome. Honduras is like, yeah, special. Yeah. I like every time I plan a trip, I'm like, hey, Em, what do you think about July? Hey, Em, what do you think about October?
In July, I'm already booked for work, but the October Honduras, that is a possibility.
Do it
right now. And yeah, Dave, come on.
Yeah, well, that is, how can you say no? It's kind of like, it's almost like I'd have to check in with some people, but I'm totally keen. I think it sounds awesome. Like, I would be such an amazing experience.
And I feel like we could spend like an entire other episode talking just around this, but it's the whole leadership component of it. And you know, Dan, like Dave and I are both leadership coaches, and you spoke of, Dan, about how everyone who's a part of the organization makes it so that you can go in and effectively do your job. And so the level of leadership that must be in that organization must just be so on point. And, you know, with that, even like, what would be like, even just one thing that you take from that, from a leadership standpoint, that you are then able to bring back and apply to your work as an emergency physician in Colorado, that you have learned from your time traveling?
Just, you know, I don't know. I used to do kind of another long story. I used to travel with a group, kind of doing consulting work about the physician experience, because, you know, as physicians, we're always told, you know, the thing that we're harped on over and over and over is how important the patient experience is, right? The problem is the patient experience is, no matter how many rules you follow, no matter how many tools you employ, if the physician experience isn't a good one, it doesn't matter. Everything else comes off as just not true and not genuine. But if if you peel away all the stuff that goes into being a doctor, or you peel away all the expectations when you go on one of these trips about what am I going to do, the thing that is the most important in whether I'm here in the US, if I'm, you know, down one of these trips, is like remembering what it means to be a care provider, or just somebody who just like gets the essence of medicine. And that is, life is painful. There are parts of life that are just, you know, a life without struggle and a life without pain would be, it just doesn't happen. But if I, as a person or as a physician, can remove some sorrow or some difficulty or some pain in some small way, like treating your kid for an ear infection so he's not screaming all night, like, that's the gift. That's the thing that if you don't hold on and you don't recognize what you just did for another human being, then you are not enjoying all the work you put into getting where you're at. So I don't know if that answers the question either, but it's like getting back to the essence of why we chose to do the work that we do. And that's just everywhere. That's every patient, every place, every country, every time, is if you can get back to that essence of caring for somebody, your life is better for it, and everything is better for it. So maybe
Yeah.
another really long answer to a really short question. So
No, I love it. I love it. And Dan, you are definitely a person who just, yeah, I mean, you display care and compassion in everything that you do. And not only that, you have this beautiful sense of humor and a personality that backs it up. And yeah, I am so appreciative of you coming on the podcast and sharing all that you do and all that you stand for, and teaching myself and Dave and the listeners more about the international medical relief, and just this greater piece of just how we all can do a part, and that we think it might be small, but that it really does. We have the ability to create huge impact. And but it's that thing around, are we going to kind of step past that fear of failure or fear of not being able to do something to just actually take action? So thank you so much for your time and
thank you
for
guys.
coming on the podcast, despite looking as tired as you do. I'm just joking.
I'm jealous of the tan. I'm thinking how pasty I look. Both you guys are.
Oh, this is not a healthy tan. This is a man that forgets to put on sunscreen every single day. So
yeah, I feel like I've the last time I saw you, you had that same look of I'm beginning to think it's just a permanent look that you have.
They call this night doc. It's really hard to acquire. It's real nice, real good.
And so we are going to list all of Dr. Dan's information and any of the extras we discussed in the show notes, including the link to the International Medical Relief Organization. And the best place to find all of that information is going to be on our website. And we're active on LinkedIn, Facebook, and Twitter. And the YouTube, or the video version, is available on YouTube and Facebook. And of course, the podcast is available on all of your favorite podcast platforms. Dan, thank you so much for coming on The Boiling Point. And Dave, a pleasure as always.
Yeah, thanks for inviting Dan. What a great story. I mean, what a great conversation, and what a cool organization. That and what a neat opportunity, Honduras in October potentially. So
yes,
there we go. Bye, everybody.
Thank you for listening. Follow or subscribe to the show on your favorite podcast app, or visit boilingpointpodcast.com for more.